Okay, right, we're here with Ben Clarsen today. Hello, Ben. Thank you so much for joining me today.
Hello, and thanks very much for the invitation.
You're most welcome. Today we are talking sports physiotherapy, sports and exercise physiotherapy. So I'm hoping to chat to you about all your work and lots of things in relation to physiotherapy in the sporting world. But first of all, maybe you could just do a little introduction to yourself and to the work that you're involved in and how you got to where you are today for everyone that's listening.
Okay, sure. So I'm actually from Australia, although I live up here in Oslo in Norway, where I've been for now the past 10 years. And so I graduated from Sydney University from my Bachelor of Physiotherapy in 2001 and always had a big interest in sports. During my time as a bachelor student, I was also a competitive rower, and that meant that it took me 6 years to get through my bachelor's, and I was a terrible student, you know. But anyway, I kind of went straight into private practice. Sorry, there's a helicopter out the window right now. But anyway, we just move on from that.
Yeah.
But so I went straight into a private sports medicine practice in Sydney and worked for a couple of years before moving to France to try my luck in the world of cycling, in the world of professional cycling. I really had no real plan or context, but I just thought, get to France and see how it goes. And so I did, and I started, asking around and using some of my sort of friends and contacts from rowing days. Ended up landing a job with the Australian national cycling team as a physiotherapist, a part-time physiotherapist every now and then. And that kind of led on to more and more work in the field of cycling, where I ended up working for several years actually in the professional teams, so in the professional world, and on some of the biggest teams in the world, and had a lot of great adventures, working in all these big races and what have you. It was a really, really good fun. But physio-wise, it was quite a challenge because you're pretty much on your own the whole time. And I hadn't been that long out of school, and I had a lot of questions and a lot of, really, really was kind of operating in a bit of a vacuum at that point. So I really, really wanted to do a master's degree. And so I looked around the world and looked at where I could do a master's in sports physiotherapy. And probably at that point, the obvious answer would have been Australia, but I really wasn't ready to go home and end the adventure yet. So, and I happened to have a Norwegian girlfriend, and I saw that there was this new master's program up in Norway. So we decided, okay, let's move up to Oslo for a year or two, and so I can do my master's, and we're still here now, 10 years later. And I guess my ambition there was to just become a better clinician and answer some of the clinical questions that I had, because I guess I wasn't really exposed to the research world so much in my undergraduate career. It was there, but I sort of had my blinkers on and just thought I was going straight into a clinical career. But it was a bit of a happy accident that I just landed in this fantastic research group up in Oslo that are all clinical researchers. They're all, clinicians and researchers, and doing this fantastic work in sports injury prevention. And I ended up just becoming totally hooked, and I have then since done first my master's in sports physiotherapy and then my PhD with the same group. And that is at the Oslo Sports Trauma Research Centre, which is then based at the Norwegian School of Sports Sciences in Oslo. And I guess we'll talk a bit about my research and what we've done there in the field of overuse injuries and overuse injury prevention. And on the side of that, I've kept up my clinical work. So I'm working also in both in private practice and in the Norwegian Olympic program, where I've, amongst other things, followed the national cycling team pretty much since I've arrived in Norway. Yeah, I guess that's where we're at now. So, I mean, I have a bunch of other balls in the air. I'm editing a textbook at the moment, so the fifth edition of the Bruckner and Kahn's Clinical Sports Medicine. So I'm kind of the senior editor there together with Karim Khan and Peter Bruckner, and we're sort of trying to pull together this new edition, which is actually a complete revision of this textbook. We're really starting from scratch in many, many chapters, a lot of new authors, a lot of new chapters and what have you. So that's been a massive job. And I've also, together with a couple of colleagues, have started a online education program for sports physiotherapists through the International Olympic Committee.
I saw that course just now. I was just looking at it online. It looks very good.
Yeah, absolutely. We're very happy. I mean, it's a work in progress, but it's really it's turned out very nice. So we have fantastic lecturers, and I think the first round of students that are now 1 year into the course, they're very happy. So
yeah, good. That might be a nice follow-up for people to have a look at after some of the sort of sports physiotherapy education things that we provide, but we can provide links to that course if anyone's interested in taking their education further, because I think it looks like a good course. So
I'm sure and the two programs. So.
Yeah. Okay, good. It sounds like you are involved in so many things and have an awful lot of experience in sport. So hopefully we can capture some of your knowledge today when we talk to you. But let's have a perhaps first tell us a little bit about your PhD. Was it in overuse injuries? Is that correct?
That's right. Well, I guess to take it right back, I came from a real cycling background and a real interest in cycling, and had all these ideas about ways in which we may be able to prevent cycling injuries and treat them and what have you, and a lot of ideas particularly around biomechanics and the biomechanics of injury in cycling. And so I came to my seniors, my supervisors and what have you at the Oslo Sports Trauma Research Centre, and they said, well, that's all well and good, it's good to have ideas, but you can't just kind of attack randomly at a question. We need to start from the beginning and do it really, really systematically. So map out the problem, what are the epidemiology of the problem, and then go on, look at the risk factors, look at the mechanisms of injury, come up with ideas for prevention and test it. So it's a real model of sports injury prevention that we use regardless of the sport or regardless of the injury that we're talking about. So they convinced me to, instead of going down the biomechanics road, start with the epidemiology. And my master's project was to then map out the main types of injuries among professional cyclists, and we went and did a cross-sectional study where, in fact, it was quite a frustrating experience. I mean, the article was fine; it was a step forward in a way, but the frustrating thing was the tools that were available at the time to map out injuries and to really measure their magnitude were completely inadequate for overuse injuries. So they were tools that were developed to count and measure the rate of acute injuries, like ACL injuries, things that are really obvious. You tell when it's happened, you can map out their severity by the amount of time lost that they cause. And it's quite a simple approach that had been used in sports injury epidemiology, sports injury prevention for many years already. But when you try and apply those same methods to overuse injuries, you really miss a vast majority of the problems, because most overuse injuries don't lead to time loss. And that's really the threshold for when you say an injury has occurred is when the athlete is unavailable. But I think any of us that have worked with athletes before, we know that they push on as far as they can. They use all sorts of, ways of coping to continue to participate. And so they stay very much under the radar. And so I guess through that experience, I learned, and my supervisors were already all over it, I guess, but they kind of realized that we need to start from scratch and develop a completely new way of mapping out the problem of overuse injuries in sport. And so, I mean, the way that we would do that then is really going out actively to a whole group. If we're studying, say 100 athletes, we want to go out to them at regular occasions and ask them, how are you? Do you have any problems? Do you have anything that's affecting your participation or your performance or any symptoms or what have you, with a questionnaire, for example. And so we developed a questionnaire and also a way of using electronic tools to then, administer that questionnaire to large groups of athletes at regular intervals to then map out, who's got what problems in a way. And so my PhD was really to develop that tool and then test it, apply it in a range of different scenarios and what have you, to be able to use it in sports injury prevention research. And so I guess it was very much a research focus when we started the project. But what we found out was there was also a real practical benefit of doing the same thing. In the Norwegian Olympic program, we have some pretty big challenges, which I think are quite common, at least across individual sports around the world, and where our athletes are at any given point, they're all over the world, and they have varying degrees of medical contact. So sometimes some of them are very well supported. Others, they go long periods without access to their doctors and their physios, or they're being followed by multiple teams at times throughout the year. So they may have a national team and a professional team and a local support group where they live and what have you. And so the information flow is really bad for these athletes, and a lot of problems can go under the radar for quite a long time before the kind of medical team knows about it. And so we started to apply pretty much the same approach with a slightly different version of the questionnaire going out to all our Olympic athletes once a week, that is really just acting as a safety net to make sure that everyone knows about everything at all times, and that the Olympic medical team is really able to follow our athletes wherever they are in the world, and whoever has sort of the main responsibility at any given point, we at least have one team, one doctor and one physio that have that responsibility for the athletes at all times. So we kind of now have this parallel tool that is both a research tool for collecting high quality information about the real magnitude of overuse injuries in a population, which can be used for epidemiology studies, for prevention studies and what have you. And then we have a sort of another version of the tool in a way that is used very, very practically for just quality assurance of medical care for, high level athletes.
And so am I right in saying that questionnaire that you've developed is an app that can be used now?
Yeah, we originally developed it. I mean, this is in 2010, so this is a little bit sort of pre-app boom in a way, and we developed it as an online questionnaire using one of these, programs that you can define all the questions, and it goes out as an email, once a week or whatever, and then you download an Excel spreadsheet and you kind of work manually from there. But since then, we've developed an app which has been a huge undertaking, much bigger than we thought. And we're just getting to the finish line there. So I don't think it's commercially available yet, but we're certainly using it in our research and kind of with the final prototypes in a way. But I think we're not far away from being able to offer it. Actually, we have a commercial partner that developed it in partnership with us then, but and so it's not a commercial venture for us. But I think that people interested in using it will be available very soon.
Sounds good.
I guess the challenge has been not just the development of the app, but all automation of all the processes afterwards. So now in our Olympic team, we have a dashboard. So each doctor and physio can go onto their dashboard and see their team, see their health status, go in and look at all the reports and go in and classify and diagnose and what have you. So it's a really nice adjunct to the medical records, you could call it. But I mean, the development of that software and the interface between the app and the website has been a real challenge. And,
okay.
We've been working on it now for a couple of years, and it's going well, and when it works really well.
Good. I think I'm going to come back to that. What I want to ask you is, so in this questionnaire is about sort of monitoring health and wellness in the athlete, isn't it? So what kind of questions are you asking in this questionnaire of them?
Well, we ask 4 key questions to athletes And let's stay with the version that is the practical tool for athlete monitoring. It's very similar, but okay. But either way, both versions start with the same 4 questions, and they are: have you had any type of health problem that has affected your participation in sport in the past 7 days? And they can rate it from absolutely no problems to reduced participation or complete inability to participate. It goes on then: to what extent have you modified your training participation, so reduced your training volume, for example, and it's once again categories. To what extent has your performance been affected, and to what extent have you experienced symptoms? And there's a logic to the questionnaire. So if the athlete answers no 4 times, so it's almost the same question, you're just attacking it from different angles and teasing out these minor problems. But if they say no 4 times, then okay, that's fine. The questionnaire is finished. But if they answer any kind of problem, even just mild symptoms, then it goes on. And we start very broad. So we talk about any kind of health problem. It could be an injury, it could be a runny nose, whatever, and then it goes on. Okay, are we talking here about an injury or an illness, an overuse or an acute injury, based on the mechanism and the mode of onset? And then it branches again. So if you talk about an illness, you can list your symptoms, and if it's an injury, you say where it is in the body. And then, because we're using it as a reporting tool back to the medical staff, we collect a bit of information that helps them. For example, how much time loss have they had in this week? And that also helps us in epidemiology to classify it as a time loss injury or not. Who knows about it? So especially when they're out traveling, so that we get a little bit of a feel for the urgency of how quickly do we need to take contact with the athlete and try and help them. And also there's a field where they can send us messages, open like a SMS type thing, where they can say, okay, all under control, or book me an appointment, or whatever. And then the questionnaire can loop. So if they have several problems at the same time, then it goes back to the start. So I mean, in essence, it's a very, very short questionnaire, and we were very aware of keeping it short because we do it so often. So we do it, once a week for most athletes. But but if they're healthy and they're used to the questions, then they can click through it in 10 seconds. It's just 10 seconds once a week. And even just that is fantastic information for the physio and the doctor. Just all's good. I'm healthy. You guys can relax and keep working on all the other things. But and then if they have something to report, it might take them maybe 2 minutes to go through the proper full length questionnaire.
So you're able to pick up on many different kinds of illnesses or injuries that they might be presenting with. Are you specifically looking for overuse injuries in this, or is your interest in it developed?
We want to do everything. I mean, from my research background, I'm very particularly interested in overuse injuries, but I mean, we do want to capture all types of injuries and illnesses for that matter. From a prevention perspective, at least what you could call secondary prevention. So, trying to stop a problem from becoming a big one, a small problem, and capturing things early, then it's of most use for overuse injuries because they come gradually. And it's hard to prevent an ankle sprain that's already happened using this approach. Right? And the same with an illness. The time lag is a bit long, that they're already sick by the time they report it. But what we can do is identify athletes that have, for example, repeated illnesses, or if we do it, long enough, we see periods of the year where they may be sick, so we kind of can more pattern recognition and pull out those athletes where, maybe just a conversation starter, how's your hygiene, what are your routines, why are you sick 7 times a year when the rest of your team is sick 3 times a year, that type of thing is valuable information. But certainly from a early action, early intervention perspective, then it's overuse injuries that are the big winners here.
Yeah, and so you're kind of describing, when you're talking about this constant monitoring, not constant monitoring, but weekly input that you're asking the athletes to give you, and you're monitoring that. That's one particular role, isn't it, the physio. It sounds like that's a role of the physiotherapist when working with athletes and sports people. So one role is this monitoring of their health status, so that you can intervene where you need to keep them performing at a high level.
Well, absolutely. I think that, I mean, athlete monitoring is huge now, you know what I mean? Especially in some countries, like in Australia, it's just massive, you know, and right. And I think it's a role of the sports physiotherapist and together with the sports science team. So I think there's different cultures for the different roles in different countries, but certainly I think there's a lot of opportunities, and I think it's for sports physiotherapists to become more involved in monitoring. And I think it's important when you think about athlete monitoring to separate a little bit between what we've been doing so far with just capturing things that have already, or sort of early recognition and collection of data, which is more and more valuable over time for epidemiological data for your team, right? And then there's the approach which is much more about trying to predict who is going to get injured or who's going to get sick, or trying, you know, looking at or signs of overtraining or fatigue monitoring, which is another really, really exciting field. And it's what we're also starting with now. You know, now that we feel that we've kind of got step one, we're kind of moving on to step two. And look, you know, there's a lot of also questionnaires and a lot of professional sports teams, especially, you know, professional football and team sports. There's this kind of more daily monitoring approach where you're asking, you know, how are you feeling? Are you stressed? Are you ready to train? Are you sore? You know, and then the kind of more like traffic light approach, that if someone starts to answer outside of what's normal for them, you know what I mean? So, you know, or that their responses change, or that their responses cannot be explained by the training program. You know what I mean? That they haven't had a particularly hard session, yet they're feeling terrible the next day. You know, that's a warning sign that they need to be perhaps training a bit easier, or pulled out of training, or what have you. And that's, you know, a bit of a parallel to what we've been doing, but now we're trying to marry those two up. And certainly, you know, then you've got the field of load monitoring and looking at how much work they're doing, you know, external work. So how much they're training, you know, in different sports, you can measure it in different ways. But in the same way, and what Tim Gavitt's been doing in Australia with, you know, really, really exciting stuff on load monitoring and prediction of injury, or looking at, you know, limits in how much you can progress a training program from week to week, for example, is another branch of this whole kind of athlete monitoring business, which is just, I think it's, for me, it's the most exciting thing happening in sports medicine at the moment. But you know,
yeah, I think in sports medicine you've got such a great opportunity to monitor the athlete or the person that you're working with. We just don't have that opportunity with the general public and their illnesses, and not yet, I think.
Well, I think though that, you know, there is a lot of opportunities for using similar approaches to what we're doing with athletes, but with regular patients. Certainly in terms of patient-reported outcome measures. So, you know, if we have a patient come in with an Achilles tendinopathy, for example, you know, that you can sit down with them on their first session. You know, we would try and give them an outcome measure like the Visa score, and then they fill that out. But then you can, you know, give them the app or the whatever, and that, you know, you schedule it so that every month they're doing it. Do you know what I mean? And then, so regardless of how often you're seeing them as a patient or whatever, they get the questionnaire on their phone, and they do their Visa and what have you. And I think that, you know, this will help us to, you know, and these are tools that were developed really as research tools, but I think they're also very valuable as clinical tools. So we can do better with our normal patients as well.
Yeah, for sure. And I think that's really important, isn't it? And it's important for people to remember that even if they're not working with elite athletes, they can still use similar approaches with just the amateur athletes working in.
Even though, you know, these ideas of the Gavitt group in Australia of how much can you increase your training from week to week, or, you know, these fluctuations in training as a kind of risk factor for injury. I think those principles can also be applied to your weekend warriors and what have you, where and just the awareness of their load, how much they're doing, their intensity, the duration, and keeping a training diary and looking at this. Most athletes that come in with overuse injuries kind of come in because their training has been unstructured in one way or another, and they've kind of made these mistakes. So just teaching normal patients or active patients about these same principles, I think, is a very, very valuable thing.
Yeah, good. That's why it's always good to speak to people like you who are up on the athlete side of things, so we can learn from what your approach and what you're doing with the athletes.
But I think it goes both ways. I recently, last year, I started back in a clinic one evening a week, just working with every general patient population. I mean, they're pretty active, sort of athletic, but it's kids, it's older people, it's certainly not elite athletes, and I think that's really, really improved my work with all with top athletes as well. I think we certainly it goes both ways, and I reckon that sports physios that only work in elite sports exclusively are really missing out on a learning opportunity, which for that comes from treating a really, really broad population.
Okay, that's interesting.
And I think it's important. I think that the best functioning sports teams that I've come across, professional sports teams, are ones where they encourage their employees, their health team, to also continue their general practice on the side of the work with the team. It's not, if you imagine you're a physio for a professional football team of 25 players or what have you, I mean, you may see one ACL injury every second year. You don't get that good at treating ACL injuries because you just don't see that many. But if you're working also in a general sports medicine practice, you may have, 15, 20 ACL patients a year, that it gives you a chance to be really good when that star player gets his ACL injury. So I think it's important to keep the balance between elite and general.
It's a good point. Yeah, it's a good point. So we've been talking about health monitoring, I suppose, in the athlete as one role of the physiotherapist. Now, I know there are many other roles of the physiotherapist working with athletes and in sports. So what do you think are the other roles of the physiotherapist in these situations? And I know they'll be different in different countries and in different situations. What are the main roles of the physiotherapist in sports?
Well, I mean, we've got the roles that are common to most physiotherapists in most situations. I would imagine that would be, the diagnosis and treatment of injuries. That's a kind of given in a way, rehabilitation and what have you. But if we think about other things that are more particular to sport, I mean, firstly, most traveling sports physios do a lot of stuff that's completely unrelated to sports physiotherapy, and that's a part of the game. You got to. When I've been traveling with cycling teams, you do everything from making sandwiches to washing cars to booking hotel rooms or whatever. You do what you have to do, and that's okay. I think in the very beginning I got a bit, up in arms about it. It's like I didn't go to school for so long to do this, But at the same time, and kind of pushed back a bit. But then I realized after a while that is a part of being in a team, and you got to chip in, and you know what I mean. And when you're a traveling sports physio, you often don't travel. You tend to travel with relatively healthy athletes. So your work is maybe helping athletes to physically prepare and mentally prepare, actually, but and find what they have, or help them to find those last percentage points, perhaps with preparation, massage or stretching or whatever, and then helping them with recovery and what have you. But you don't use your diagnostic and real rehabilitation skills out on the road that much. Do you know what I mean? Because you leave the injured people at home, right? So I think, you're obliged in a way to lend a hand where you can as well. And most most sports teams operate on goodwill, and they operate on the fact that everyone pitches in, and even at a professional level, it's still very much like that.
Yeah, interesting.
So that's one role of the sports physio, is to be a bit of a general, all-round help.
All-round help. You mentioned preparation and recovery as well. So can you just elaborate a little bit on those two aspects of looking after or helping an athlete?
Sure. It depends on, and there is where there's massive differences between sports in the culture of what it is for preparation. So I think we're moving much more into, in the same way we are with our treatments as physios, we're moving much more into an active approach rather than passive, kind of hands-on passive stretching or massage or what have you, to designing warming up programs, designing programs that will help their neuromuscular control, so kind of firing them up and motor patterns and what have you. And that's something that the physio should be doing together with the technical coaching staff, I think, but we can really add value there. In cycling, it's pretty traditional, it's pretty old school, and a lot of the athletes still expect a lot of massage and kind of passive approaches. So that's okay. I see that more as a mental preparation rather than anything that, you got to, if the athlete feels that they need it to prepare to perform, then I'm kind of okay with it, even though the evidence may suggest that it doesn't really do that much. But okay, I don't go out of my way to encourage athletes to be reliant on any form of passive, modalities of any sort. But inevitably when you're away on the road, you do a bit of massage, right? And recoveries. Look, it's a big field, the field of sports athletic recovery, and there's all sorts of products and approaches to it, and everything from these cold water immersion or contrast bath water therapies, and different products, compression products and what have you. I think that a lot of that there we're really talking marginal gains, and I think most athletes need to focus at least on the big gains rather than the marginal gains, because even top athletes don't do things correctly. And I think we're if we're knowledgeable about nutritional strategies, if we're knowledgeable about sleep and all the sleep hygiene and sleep routines and what have you, I think they're the two absolute biggest. If you don't have your nutrition right and your sleep right, then you're completely wasting your time if you're talking about compression clothing or contrast water or anything like that. And in my experience with professional sports teams, not just cycling, but many sports teams, they've got a long way to go on the big gains before they focus on the marginal gains. But I think the role of the sports physio is certainly to be current on the evidence and for all these different recovery modalities, and know where the priorities should be, and where and communicate that to the athletes and the training staff, because coaches are pretty quick to jump on bandwagons and be convinced about all the latest fanciest stuff and most expensive and what have you, but nutrition, sleep, they're the big ones.
So with sleep and nutrition, and can I group stress into there as well with those sort of things?
Yeah, totally.
Yeah, with those three things. Is there
Go on.
I was just wondering how much as a physiotherapist you get involved in those kind of things, or do you have other healthcare professionals on the team that do more of that?
It depends on the team. Certainly at the Norwegian Olympic program, we have sports scientists, we have sports psychologists, so people that are much more expert than the physio in that role. But I think that's a pretty privileged situation to have such a multidisciplinary team, and I think that in many cases the physio is very much on their own. in a team and needs to be aware of these things and needs to have, and there are some great articles and resources out there, in the sports medicine literature. They're quite easily available, and I think, it's certainly within the job description of sports physiotherapy to understand the principles, and then depending on your situation is how much of that becomes your responsibility compared to just you're a support player and you make sure you are identifying which athletes need to be talking to the psych or to the sports scientist or whatever. But I think as a physio, we're in quite a unique position where we really get to know the athletes. We spend a lot of time with them, and we're often the main contact in with the athletes.
Yeah. So I'm hearing.
Actually, I'm getting back.
No.
So, you're asking about the role of the sports physio, and actually, what I find very, very interesting is in the last, say, 5 years, there's more and more professional or elite sporting environments where the main medical coordinator is a physio. So it's traditionally been a doctor, and it's really been a top-down, doctor-driven culture. But physios do a great job, we are in that medical coordinator role, and we, because of our contact with athletes and with the whole team, whereas doctors are often really, really busy, they come in as kind of expert consultants in a way, but they're not necessarily the best place to really get their hands dirty and be really, really involved in the day-to-day running of team and the team medical staff and or medical apparatus, if you know what I mean. So look, we have, even amongst in the Norwegian program or my through my discussions with others in professional football and what have you, there are some examples where a doctor does it. There's some examples where a physio does it, and there's no right and wrong. But certainly, I think that's a really exciting area that physios can look towards, especially in the second half of their careers. Maybe once they're looking for new opportunities and new challenges, then I think that's a great one.
Yeah, so I'm definitely hearing that. That there are many different situations that a sports physiotherapist can find themselves in. They might be the sole person managing a bunch of athletes, or they could just be a small piece of a huge scientific team. So the role of the physiotherapist in sport is just going to totally depend on the situation and that they find themselves in, and how far their role extends, I suppose. You mentioned I'm interested to know, you mentioned, so when you're a sole physiotherapist, like you were, perhaps on the cycling teams, that it can be quite lonely. So how do you cope with that as a sole physiotherapist when you're alone out on the road with your team?
Well, I think it's inevitable that you become very close to the athletes. So you really become friends with the athletes and the coaches and the mechanics or the other support staff, and that becomes quite a family situation, and that's really, really nice. But that also creates some challenges. I think that becoming best friends with the athletes isn't necessarily the smartest thing either. Do you know what I mean? Because in some situations you need to have some kind of professional distance. So that's always the challenge for the sports physio, that you want to, especially when you're young, you're the same age, you're all interested in the same thing, and it's easy to become really, really close, right? But you need to keep it in the back of your mind as well, that there is that kind of professional distance there, and at times you need to be able to have a slight separation there. Look, apart from, and so I've made some great friends amongst the other support staff that you travel with, and you read a lot. You get out. It's always a challenge to see the world. You think that it's so exciting, to be out traveling all these kind of exotic places, but typically you're working from the minute you get up to the minute you go to bed, and it's really hard. And at least in cycling, you're staying in the outskirts of town in some kind of 3-star hotel or something. You don't see that much unless you're pretty motivated. Do you know what I mean? It's often after you finish your work at like 10 or 11 p.m. that you actually get out and see the town, and so that's one thing. And then I always took with me a lot of, I guess because I was operating in a bit of a professional vacuum, I always took with me a lot of textbooks and a lot of, reading stuff and articles and what have you, and tried to kind of stay current as best possible. I guess these days it's a bit easier with.
I was just going to say that these days, anyone out who's out with a professional cycling team, you can tweet Ben and ask him your questions.
But no, that's totally true, and I think that it must be I'm not in that situation anymore, and I think it would have been it's a different situation now. But I also, when we were envisaging this course for the IOC for sports physios, I was really kind of thinking back to those times as well when I was so hungry for information. But, I was traveling like up to 200 days a year, and just the opportunity to go and do a master's or something was really hard. So, the ability to study and learn in a structured way, but on your own terms, on your own, in your own time, was that's, I guess, our main group that we're targeting, although there are others that do the course. I guess our primary kind of target group are those that are perhaps already working in sports, that are hungry for information but can't see how they can otherwise do it.
Yeah, and it's a common situation, isn't it? So I think that's a really good approach to take. Definitely.
Yeah, absolutely.
Yeah. So the other thing you're working on is the clinical sports medicine textbook. Did I call it right? Is that the right name?
That's right, yeah. I think the official name is still Bruckner and Kahn's Clinical Sports Medicine, Volume 5.
Bruckner and Kahn's Clinical Sports Medicine. So you're doing the new edition of that textbook. So whilst you've been doing that edition, you mentioned you've got lots of new authors and things like that. So I'm just wondering, in relation to that, what is new in sports medicine?
Well, certainly the field of load monitoring, as we've already discussed. I think that's really, really new and really exciting.
And what was the name of the group in Australia doing the loading monitoring work?
I guess the main scientist pushing it or leading the field is a guy called Tim Gabbett.
Tim Gabbett.
And I mean, search him on PubMed, you'll find. Enough to keep you going for a week or two. I think he's got 2 PhDs.
Doctor.
But he's a great guy, and actually there's some really, really good podcasts with him out there as well, which could probably guide you to that. He's really, really good at explaining his stuff. And
okay. So load monitoring. Anything else? And I guess this nutrition and sleep is a big new area coming.
Yeah, we've got a new chapter on that. And then I'm just trying to think about the structure of the textbook and which new chapters we have. We also have a new chapter on patient-reported outcome measures and a much greater focus on that throughout the book. Also, one of the big things we've tried to focus on is, I mean, if you look at previous editions and a typical sports medicine textbooks, it's, you have your clinical examination section of the chapter, and it's raised, this is a good test and that's a good test for this or that, you know what I mean? And but I think there's been massive advances in, and not just in sports physiotherapy, but in physiotherapy, on a greater focus on the clinical utility of the various tests that we're doing. So what is the sensitivity and specificity and the positive and negative likelihood ratios and whatever. So how does a positive or a negative test influence your clinical decision making? And this is a field, I mean, look, all over the world there's been an increase in focus on it, but I feel the American physical therapy profession has really been leading the way here, and they've been absolutely fantastic. There's a couple of, a handful, I guess, of key physios driving it in America, and we have certainly tried to get them on board in the book and in all our chapters in the clinical examination part of it to include information on the clinical utility of those tests. And I think, without that information, you're really still just stabbing in the dark. And I guess one of these physios that often, uses the catchphrase that special tests aren't always that special. They don't really change your decision making that much. But unless they have this kind of fantastic sensitivity and specificity, which very few of them do, or you look at this typical situation where the person who the test is named after publishes a test and it's fantastic and, it's got this really good sensitivity and specificity, but then it doesn't stand up to repeated tests. And so, once you start looking at systematic reviews and meta-analysis of the data, then, all of a sudden it's not as good as maybe we thought it was. So, I think that highlights the value or not of the various tests that we do, and also really, really highlights the importance of the history taking, which is where we make a lot of our, key decisions actually about what the problem is we're dealing with, and a clinical examination can absolutely confirm or otherwise the hypothesis, but you need to know how good the tests are to be able to really apply any kind of clinical reasoning.
Yeah, for sure.
So that's a very kind of exciting thing happening, I think, across the board in physiotherapy and sports medicine. What else is new? I think certainly a move from passive treatments to a more active approach. And I think, there's some really, really key moments, I guess, in the whole idea, and certainly the paper that was published by Karim Khan and Alex Scott on mechanotransduction mechanotherapy in, I think it was 2009. I think that really set the ball rolling to kind of give us an understanding of what we're actually doing on a tissue level when we're giving a kind of therapeutic exercise prescription. And certainly I did my physio education in the 90s, and still, a lot of focus on electrotherapies and passive and manual therapies and what have you. And I feel that sports medicine has slowly been moving towards a more active approach, and I think that it's maybe not a big sexy new thing to talk about, but it is probably the most important thing that has happened in sports physiotherapy in the last 15 years. That we have actually understood where in the grand scheme of things does therapeutic exercise play a role, and a massive central role, of course, and then where is manual therapy and electrotherapy and all the other kind of adjuncts that we may or may not choose to do, but they are certainly secondary and inadequate in themselves, whereas I don't think we learnt that well enough in school.
No, I think you're right. And you're describing, so therapeutic exercise as the active approach, and electrotherapy and manual therapy and massage, for instance, as the passive approach, as the adjuncts.
Exactly.
Yeah.
So, I think a key message in the textbook that we're trying to give is that it's hard to imagine a situation in a sports injury sense where your primary intervention is not going to be some form of therapeutic exercise, or of load management in one way or another. It could be to unload it if you have a good rationale for that, but it's rarely going to be a manual therapy that is your primary intervention. This is a terribly divisive topic. Some people are way against it, other people are way for it, and what have you. But I think we can all agree that if you're going to do it, it's certainly not going to be the main thing that you do or the only thing that you do. Right? Same with electrical therapies. Even if there is good evidence that it works, that's great. There's very few where there is good evidence, by the way. But okay, if there are some forms of electrotherapy where there is some evidence, right?
In a specific circumstances,
Yeah, exactly. And I think electrotherapies in particular, look, in a typical clinical scenario where you have 20 minutes, half an hour with a patient, it's, very, very rare where you would choose to use any of those minutes on electrotherapies. But, perhaps if there is evidence for their efficacy and you have all day with a patient because they're a professional athlete, maybe.
Absolutely, yeah. Okay, so that was moving back onto load monitoring and load managing as well, with the therapeutic exercise at the centre of that. So we're talking about load monitoring management, new active therapies, and then the clinical utility of tests. Yeah.
Okay. Look, I mean, beyond that, in the textbook, I think what we've tried to do is, instead of update, is to kind of almost, so looking at a chapter from the last edition and say, okay, what needs to be updated, what's new, where's the new research or what have you. It's to more say, okay, what can we keep? Let's kind of start again and start from scratch. And we have, 70 or more than 70 new authors in the book. So there's a lot of kind of young generation of kind of sort of postdoctoral level clinicians and clinical researchers that have kind of come in and added hugely to the book. And I think that, in some chapters we've completely started again, and in other chapters that were very current and up to date already in the last edition, then there's been some updates, what I mean? But I think for those people that are familiar with all the editions previously, that this will probably be the biggest change from one edition to the next that people have seen. The other main change is that before it was a book on sports medicine in general, so it covered everything from injuries to travel medicine and allergies and what have you. But it's been split into 2 volumes, so that there's an injuries volume and then there's a more sports and exercise medicine volume, which will come in a couple of years, I guess.
Cool.
But
When can we expect that to be released?
Good question. We've been working on it now for 2 years, and I think, look, about half the chapters are in with the publishers already, and we're aiming to get the rest in by the end of July. So it's really in the downhill phase, but it's just incredible, the amount of work. I mean, it's the first time for me, and just when you think you're almost there, and then there's so much fact checking and referencing, and it's just incredible.
Well, it sounds like it's going to be an amazing book. So with so many people involved, I think it sounds like it'll be our sports medicine textbook, possibly.
Well, for me, it got me through my undergraduate and my first few years, almost on its own. I remember making excuses to my patients, to go, I've got to go take a phone call, it's running out the back. What do I do? And I think, a lot of the authors of my generation that are coming in feel the same way about the book. So there's a lot of attachment to it. It's very good. That's been just such an incredible opportunity. And, I've done a lot of different things in my career that I'd say, if I had to say which is the number one experience so far, it's probably that. It's been just fantastic.
Oh, wow. Good. That's interesting. So we've talked about a lot of things today, some really interesting topics, and particularly your health monitoring with the app that'll be out sometime soon, and that questionnaire to use with athletes and possibly with patients. Sounds really interesting. Also talked about
if people that are interested in the app, they can just send me an email and I can keep them up to date about what's happening there, and or put them in touch with the actual developers. They're a company in Belgium, so they can. That's fine.
Okay, that's a dangerous thing to say live on TV. You'll be getting hundreds of emails now.
It's directed particularly at elite athletes, so it's probably
Cool. Yeah. So really interesting. And we've talked about the role of the physio and what's new in sports medicine. Is there anything, and I'm being respectful of your time, not wanting to keep you here all night long. I can still see it's light outside there in Norway at 10 o'clock at night.
That's because it's going to be light all night. I think it's something. But
is there anything else that we haven't talked about that is a message that you'd like to send out to all those budding sports physiotherapists out there?
Wow. No, to be honest, I think we've covered a lot tonight. I'll think of something as soon as we hang up. But thanks very much for this opportunity. It's been really great. It's
been fabulous to talk to you, Ben. It's a real honour to talk to someone that's so involved in sports medicine at so many different levels and so many different sort of aspects of sports medicine, from editing books to the Olympic programs to just travelling away with a team. It's been really good to talk to you and sort of explore all that knowledge that you have from the experiences that you've had. So thank you very much for talking to us today. Just before we go, do you want to is there anywhere online that people can find out more about you and your work in particular? Website, or you're on Twitter. What's your Twitter ID?
Twitter handle is just Ben Clarsen. This was at Ben Clarsen. I guess the Oslo Sports Trauma Research Centre has a good website on all things sports injury prevention, and we're actually developing now a new website which will go live in the autumn, and that will initially be only in Norwegian, but we're translating everything to English, and it's a website that is sports injury prevention information aimed at athletes and coaches and parents and what have you. So on quite a simple level, but really, and with videos and information on how to prevent injuries. And the website is called, it's a Norwegian word at this stage, but it's skadefri, SKADEFRI.no.
Okay.
So perhaps you can put a link to that one.
I've written that down. I'll add a link to that in with this.
Look, the site already exists in Norwegian, but soon it will be completely updated with brand new information, both in Norwegian and in English.
Perfect.
What else? We have also developed an app for the IOC on sports injury prevention, which is also a range of exercises based on sort of evidence-based research in injury prevention in a variety of different sports and different levels and what have you. And that app is called Get Set, and it's available for free from the web.
I'll look that up. Yes.
Or what else? Yeah. I think that's enough.
Yeah, perfect. I think. And if you can't find any of that, I would just go on then.
Yeah, the IC diploma in sports physical therapies.
Yeah.
That is Googleable, but but certainly for anyone interested in continuing education in sports physical therapy, that would be a great place to start.
So that's the IOC diploma in sports physical therapy, isn't it?
Yeah.
Cool. Great. There's some great places to find you. I think if anyone has missed any of that or has any questions for Ben, we can find him on Twitter, Ben Clarsen. And that's probably it for today. So thank you so much, Ben. It's been a pleasure to talk to you.
Thank you very much.